Hello, Chronic Matters family. Are we a family yet? I don't know. I think there's a couple people that watch. Anyway, today I want to talk about my PTSD. And this is the fourth time I've started this video because with how chronically sick I am and how exhausting everything is, I don't want to edit these videos. But we have a new puppy. Her name is Ruby. She's adorable, but she keeps, she's been taking pieces out of me and jumping up, and then she was barking, and then Gus had to go to the bathroom. Oh my gosh, they just don't want me to video. And it's windy outside, so if the door slams, I apologize. They're fixing a roof, a couple doors down, so if you hear that, sorry, Ruby's outside right now. And this, I think, is about as good as I'm gonna get for today. Onward with the story. So I have something called complex PTSD. So complex post-traumatic stress disorder. And it really only differs from post-traumatic stress disorder, like just straight up PTSD, from the aspect that mine is complex and it comes from multiple places. I have very, very long-standing issues with PTSD. I think I might be coming up on a decade now of dealing with symptoms and having to try to keep them managed. I am managed with medication. I have found medication to be imperative for my PTSD and for my anxiety as well. I've had anxiety my entire life, but I did not become aware of how severe my anxiety was until I was an adult and I had one day without it. And there's a very long story as to why I had one day without anxiety. And that's when I realized, hey, maybe other people don't live their life in constant high alert and fear and anxiety. So anyway, my PTSD was triggered kind of threefold. I lost one of my best friends in a domestic violence way. Unfortunately, it was a situation where I just knew too many details about what happened to her. He took her out, and when he took her out, he took himself out as well. And that was, at the time, that was my husband's best friend, and she was my best friend. So I just wound up knowing too much about it, too many of the details. There was a lot of guilt because I knew a couple weeks in advance how much domestic violence was going on, and she was working with the women's shelter to get out. And so I think I just at the time thought, let's let the professionals manage it. And unfortunately, even with professionals involved, it still had a negative outcome. And so the time that happened, I was upgrading nursing school, I was upgrading to go into nursing school, and it was November 22nd when it happened. And so that's right near the end of the semester, with exams and everything. And then there's Christmas, and I had 2 young children. And on February, I think 12th or something like that, I could be wrong, one of my other best friends, who I was maid of honor for, got married. So there was a very, very short period of time between the death of my one best friend and the marriage of my other best friend. And so I didn't really have time to stop and mourn that loss. And I think that really wound up playing a role. Although what I would say is the vast majority of the post-traumatic stress disorders, the components of it that I do manage, they all kind of have the same etiology, that it was me in survival mode. I didn't have the ability to stop and heal from whatever it was that was happening. And I think the reason that it goes back all the way to my childhood is basically the same reason, because I wasn't in a safe situation. Like, the trauma was coming from my home, and I was not in a safe place to manage the trauma that was happening. I had to learn how to survive the trauma, not show anyone that I was going through it. Actually, that's why I had to upgrade all of high school, basically, is I was labeled learning disabled when I was a child in grade 2, and it had nothing to do with the fact that I was learning disabled, because I did have myself fully tested again at the university level, and they found out that it was actually the opposite. I was more intelligent in a lot of areas, but had gaps in my learning history, because they had no idea that so much abuse was happening in the home. And so basically, like, my home environment was not good, and no one was coming around to ask me how I felt, let's put it that way. So I learned how to, like, kind of compress all of my emotions, and I was able to do that until I wasn't. And it happened basically overnight. I was in second year nursing school in the second semester, and I was in a retirement home working with a woman who her whole left side of her body was paralyzed, and she was 92, but she went from being completely active to completely bedridden and needing help with essentially everything, all of her activities of daily living. She couldn't get up on her own. She was quite heavy, and so, you know, she was certainly not able to manage with just the one side of her body. And unfortunately, I came in contact with toxic mold many years ago. I was still upgrading, so it was probably like 2 years prior. I was still upgrading to go into nursing school, and I came in contact with toxic mold in my house. I did have it tested, so it came back toxic, and we had to remediate it and everything. But I had a TIA and a bunch of fluid around my heart, and they said you might go on to have a stroke. And then less than a week later, I went to pick up a spoon off the floor that my toddler had dropped, and I got the most searing, like, knife-like pain through the top of my head. And I've had permanent neurological deficits ever since. And so working with this lady triggered the trauma of having this traumatic brain injury that I was still dealing with the consequences of. I have hemi-neglect, which means my brain does not account for the space it takes up, like the left side of my body takes up in space. So I will fall down the stairs on the left, I walk into walls on the left. It just has no clue I have a left side. So I noticed that this was highly triggering for me. And then there was another gentleman who was in the facility, and he was suffering from Parkinson's. He was quite late stage, so his body was no longer working for him, but he was mentally there. And one of my stepmoms actually died of a degenerative brain disease that hit her, and it took her in less than 2 years. She went from being fine to, like, just locked inside of her body, and her body wouldn't work for her anymore, and then dying about 2 years later. And people were not necessarily I mean, it's hard when you work in a facility anyway to give really good care to somebody who is 100% reliant. Like we just don't have enough time, and there's just a lot of things that I struggled about being in that situation that seemed to trigger PTSD, because I went from, like, after the murder of my friend, I went from, like, I mean, I was struggling right when that happened, but then I kind of got into a routine. I kind of got going, and I did what I always did, and I just kind of like suppressed it because I just didn't have time to deal with those feelings. And so at the time of dealing with these two people in the retirement home, all of a sudden I wasn't able to drive past a semi. The semi tractor trailers, like the ones that are 2 and 3 kind of trailers long, would throw me into an instantaneous panic attack, and I couldn't do my assignments. And the assignments weren't difficult, but I could not get my brain to focus to do the assignment that correlated with these residents in this home. And so at that point, one time, completely uncharacteristic to me because I was usually like an A student, I just wasn't able to do the assignment. And I went back the next day or after the weekend or whatever it was, and I said, like, I worked on this assignment for hours and hours and I couldn't get my brain to focus. And then I burst into tears and I said, I think I've got PTSD. And I kind of told her about like what had happened to my friend, and you know, how I was being triggered by these other 2 patients, kind of alongside everything. And she said, okay, we'll work together. We'll figure out how we're going to make it through this semester. If I needed to do, you know, like, or have some of my assignments extended, like the deadlines extended, she was happy to do that. And then I set myself up for therapy every week over the summer. And I would always take the summers off to kind of like regain and start fresh, because I had, you know, very small children when I was going through nursing school. And a lot of my time and energy was spent on that, you know, 10, 12, 14-hour days. And so, you know, I was losing out on having, you know, just the relationship that I wanted with my children, as connected as I was, and I would make sure I put them to bed every night and those sorts of things. I just needed a reset. And so that's what I would use the summer for. So I booked myself in for weekly therapy because I, at that point in time, had something called neopharmophobia and pharmacophobia. So that just means fear of new medications and fear of medications in general. And that was just as a side effect because my body was so sensitive, and I would have adverse reactions to medications. And so I was just really, really scared to take them. So I just didn't. So my first route was absolutely talk therapy. And I was carrying around 100% of this time this big black cloud, and I couldn't get it to go away. And it was being triggered by everything. It was like things that I thought I had already healed from. I thought I had healed from my childhood trauma because it wasn't bothering me every day. So, or really even at all at that point in my life. But all of a sudden I'm being triggered by it. Now looking back, I know I hadn't even touched healing from any of that. It was really just suppressed. And I am just a relatively resilient person and got very good at masking, which is a term a lot of you probably hear. You know, when you're just basically taking your internal milieu and hiding it from the outside world. And you can get very, very good at that if you practice basically for a lifetime of hiding what you actually feel inside from the outside world. So I struggled to even show the struggle to my therapist. I would verbally talk about it, but it was like I was a newscaster. I I didn't want her to see me upset. I didn't want to lose control. So talk therapy was not working for me. We got a little bit closer. I think I was about 8 weeks away, because for university, you get 4 months off, not the typical 2 that you would in high school. So when I was about 8 weeks out from starting my 3rd year, which is notoriously the hardest year in the version of the program that I was in, I was getting a little concerned, because I'd done now like 8 weekly visits of this talk therapy, and I still had that cloud. My entire life, my whole day was taken up with severe panic. I have generalized anxiety disorder. I've had it my entire life. It was not until like well into my adulthood that I even realized how severe my anxiety was, because I had never felt not having it. And so I decided that I was, despite this crippling fear of medications, I was going to go and tell my doctor that I needed something. And so I went to my physician. He knew nothing about any of my anxiety, nothing. And in fact, it's so funny, because I had PTSD after, or sorry, not PTSD, I had postpartum depression after having my son, and I didn't even realize I had postpartum depression until I had my daughter and didn't have it. So a lot of times in my life, I've realized by not having, say, anxiety for 1 day, or, you know, not having postpartum depression, I didn't realize until I didn't have it, right? Like, I just was so good at suppressing my emotions that I was hiding them even from myself. I was very unaware of how much I was internally suffering and how much energy I was putting into this act of being normal. And so I went to my family physician and I said, okay, I need to talk, and I'm gonna cry through this whole appointment. And he was really taken back, because he's never seen me cry. You know, I have now been with this physician for like however long I'd been with him, long enough for him to kind of have a baseline on me, or what he thought would be a baseline on me. And so I told him everything that was going on. And I said, I need medication at this point. It takes a long time to get onto medication. It can take, 6, 8, sometimes like 3 months to see the full effect of, an SSRI or an SNRI. So either a serotonin reuptake inhibitor or norepinephrine. Anyway, that's just the types of meds. So we decided on an SSRI that I would take, and I had, I think, 8 weeks before starting 3rd year. And it was very difficult for me to get onto the medication. And I was only on 5 milligrams of Cipralex at the time, escitalopram, depending on what you want to call it. My body was so sensitive that I remember being in a massage and my massage therapist saying, Andrea, I worry about you. And I burst into tears and I couldn't stop the tears. And it was the most bizarre thing, because I was always so in control of my emotions. I mean, sorry, there was a little fluffy flying around. I did not cry in public. That just wasn't me. And so my body was having a hard time getting on this medication, and I was so sensitive to the medication that normally you take 5 milligrams for like a week and you go up to 10. I took 5 milligrams for a year and 9 months because it was good enough. And I'm talking like I had severe PTSD at that point in time, and it was bringing up the entire kitchen sink with it. Back when I was diagnosed, I don't even think C-PTSD was on the table. If it was, it certainly wasn't in my vision or my doctor's vision. And so we just went with the diagnosis of PTSD. So I started third year nursing school, and I unfortunately came into more trauma. I think from going onto the medication, reducing my anxiety, reducing the PTSD a little bit, caused me to really look at the relationship that I was in. And I think even though like my ex-husband is a wonderful human being, we were not meant to be together, and we had nothing in common, and it became very apparent that I was not happy in the relationship that I was in. And as soon as that happened, there was no going back from that. And so in third year nursing school, I wound up getting divorced. I moved out of the house, and that was in February of 2017. That was the second semester of third year nursing school. And so I don't know if I would call that traumatic. Like, it didn't seem traumatic to me at the time, but it was very, very difficult to manage moving out. I chose to move out, and I chose to let him keep the house and everything like that, because the kids were going to be with him a lot more than they were going to be with me, on account of me doing like 15-hour days every single day. And then over the summer between third and fourth year, I met a physician, and unfortunately I was assaulted by him, and then went and did a rape kit and got the police involved, and I did eventually go on. He was arrested and charged, and I did have to go to court. So I would actually say the PTSD from the court case was more than the PTSD that I got from the assault in itself. That's a whole different story. If anyone wants to know kind of the details about that, that's a big trigger warning though. So I graduated nursing school, and I, large in part, up even through the divorce in third year, large in part had my anxiety and had my PTSD under control with the Cipralex that I was taking, even still just that 5 milligrams. But over that summer when I was assaulted and, went to the police and had to do the whole kit and everything like that, my PTSD and my stress levels just went through the roof. And so I think it was over maybe that summer. I might have even left it at 5 milligrams even through that first semester. And then in fourth year, at second semester, almost near the end of second semester, where I was doing my preceptorship, I met my current husband on Bumble. And so he and I were a very quick match in terms of relationship. But right near the start of our relationship, I was being stalked by somebody, and it was just really bad luck. He was a narcissist. I was just a little late in finding out that he was a narcissist, and getting away from them can be very difficult. So I was in a situation where it was very, very difficult, and I was now having to use some of the systems that my best friend had used before her death, and they had changed the program around after her death on account of her falling through the cracks a little bit. So they put the program together a little bit better. So I was actually going through the new program for like domestic violence, and it was with this gentleman who was I just couldn't get rid of this narcissist. And so I had met my now husband, and so I mean he's an amazing human. And despite everything, despite all the stuff that I was going through, despite that I had, you know, a rape trial open against this physician, and that was about to come to fruition, terrible timing. So as I got closer to the assault trial, my anxiety went through the roof, and then my PTSD started to go through the roof too. So I have had basically times where my complex PTSD has been very well controlled, and I would say it's not really a problem for me, to times when it's completely out of control and it's just unmanageable. So that's kind of the story about like how PTSD kind of came to be. And I've had a lot of things that have like recently triggered PTSD. I've had 16 pregnancies total, and I have 3 living children. And while I'm very thankful now for everything that I have gone through, it's been a very difficult road, and at times I will be set off with PTSD. Now, where I'm at right now, because I have for the last year been dealing with long toilet paper shortages, and that's what threw me into POTS, postural orthostatic tachycardia syndrome, which I've talked about on this channel, functional neurologic disorder, FND, which I've talked about on this channel. I would say at this point, my PTSD is not particularly well controlled. So I want to talk about what I perceive potentially to being some day-to-day differences between PTSD and C-PTSD, so complex PTSD. My husband suffers from PTSD, and there was a very specific situation that triggered it, with a very specific history that put him susceptible to having it. I won't share his story, that's his to share, but I find that I don't need to be triggered by anything specific to have a PTSD flare. Like, it's not just if I go to a certain location, I'm triggered by PTSD. It's not just if I'm watching something and it talks about a subject that I'm triggered by PTSD. When I'm in what I like to call PTSD flares, because I can tell when it's well controlled, and I can absolutely tell when it's not well controlled, lots and lots of things will set me off. And it doesn't even have to be related to my trauma itself. I can be triggered by something completely unrelated to my trauma, and then really suffer. Last night, I did have to take an anxiety med because my brain just started PTSD on its own. And then I was at the point where I wanted to throw up, and I wasn't paralyzed by fear, but I was paralyzed by disgust of what my mind had done to itself. And I told my husband, I don't normally speak about the specifics behind a PTSD flare. I might just say I'm having a PTSD flare. And I'm on a new medication now, and that happened, I don't know, a couple summers ago. So that's another whole nother story where we had to cross taper, and I'm on a medication and the dosing is too high and I really want to get off of it, but it has to be done in a very delicate way. And the psychiatrist that I had years ago, she had to leave suddenly. Her and her husband, who was also a psychiatrist, left, and I live in a fairly small place, and so we were reduced down to, I think, 3 in the city, pretty much overnight. And then those physicians, their workload became overwhelming, and I haven't been in a situation where I feel like I could manage safely coming off that medication. And because I am a registered nurse, and because I do know a lot of the people who work in the psychiatric ward, I want to be extra safe that I can do 100% of the tapering of that medication in the community. I do not want to go to the hospital. There's just really not anything that I think I just can't do it. I can't go see my friends in that capacity, because again, I have hidden so much of my trauma that when people kind of learn about how much trauma I have, and if I were to sit there and divulge the details of that trauma, people can't really handle it. Like, I think to some degree we all have our own trauma. Like, I don't think you really make it through this world without having at least some traumatic situations that you can look back on, or, you know, that might pop up into your mind at a time that's inconvenient for you. But when you have so many points of trauma, and they're not trauma that the average person manages on a daily basis, it can be quite alarming, and people maybe see you in a different way. It's almost like fear of my trauma rubbing off on them, you know? And in a way it can, because you can have PTSD from just knowing about a situation. Like I said with my one friend, I mean, I wasn't killed, right? But I knew enough about how she was killed. I knew enough about the situation. I knew enough about the behind the scenes. I knew enough to feel guilt for inaction on my part, even knowing there was nothing that I could really have done. Like, she was a very strong woman. If I had have stepped in, their best chances are she wasn't going to accept the help, because she fully believed that she had everything under control. So, you know, like, we can get it from a lot of different things, and the world is really just now coming around to the idea that this can happen to people who didn't go to war, that it can be your humdrum citizen who has, you know, PTSD or significant trauma from everyday life, that life can be that difficult and make you spiral. And honestly, I wouldn't wish PTSD on anyone. When I'm in a flare, and in the last couple years, so many traumatic things have happened that I am almost always in a flare. The only time that I had a break from PTSD was prior to the Canadian government changing their policy on ketamine therapy. Ketamine being a drug that we use for, well, we use it in the emergency room, for example, all the time if you need to reset a shoulder or something that's dislocated, basically. You know, we use it in surgery. They use it in chronic pain, although it's at much higher doses. The chronic pain, the surgery, the way that we use it in the hospital, we want, the result is to bypass the psychogenic portion of it, the hallucinogen side. You know, you want to get past that. If a person has the hallucination side of ketamine and it was delivered in the hospital, then that is not desired. So with chronic pain, which I did not have ketamine treatment for chronic pain, it's a much higher dose. So again, you don't have the hallucination portion of it. However, they have recently done studies and seen a lot of really positive outcomes from the psychogenic portion of ketamine. And I was very lucky to have my internal medicine specialist and the doctor that helps me manage my chronic pain with CBD treatment. He started a ketamine therapy program, and it was proposed to the government through, you had to meet a bunch of criteria to be able, like, to be qualified to do ketamine therapy. And so until they changed basically, I think January 1st this year, they changed that it needs to be overseen by a psychiatrist. But my internal medicine specialist, like, he had more than enough education to sign off on it, and the treatment was done in such a way that it was safe and effective. Ketamine was the most effective treatment for me for PTSD. And unfortunately, that program had to be shut down, and they're still working on bringing it back in the area that I am in. And my psychiatrist had recommended numerous of his patients go and try ketamine induced therapy for PTSD specifically. And it sounds like a lot of people who had really wonderful results from ketamine are all kind of backtracking, which is exactly the situation that I'm in. My ketamine was stopped just when we were getting to the point where we were going to start putting the treatments further and further apart, so that, and then also tapering off this other medication, because we believe that if the ketamine was supporting me, then tapering off that other medication would have been easier for me. And so January, or well, I think the end of December, I think it was like December 29th or something, was my very last treatment of ketamine, and I haven't had it since. And they're hoping that by June the program can start running in the clinic again. Now, I very much look forward to that. I don't know if like, I presume if you're watching this video, you have PTSD or C-PTSD, or you're just interested. Maybe somebody you know does have it. But I really enjoyed, I don't want to say I enjoyed ketamine. It's a whole process, and it's an unusual process. And if you want me to make a video all dedicated just to the ketamine, I can do that. But I know that a lot of us were having really great results from the ketamine, and I've been counting down the seconds until I can do the ketamine therapy again so that I can reduce this other SNRI that I'm on down to a much safer zone. We had to put me on the highest dose when I became suicidal from tapering off of the other medication that I was on that wasn't working anymore. So that's kind of my experience with PTSD. I know it interrupts my sleep, it interrupts my day-to-day life when I'm in an active flare. I'll be on the edge. If I'm in a PTSD flare, I usually am so on the edge that if my husband asks me a question in the car that requires me to pick up my phone and search something, I can't even take my eyes like off the road, because even though I've had to give up my license right now because of seizures from the functional neurologic disorder, I'm still a driver at heart, right? Like, so I'm quite hypervigilant when my PTSD is being triggered. And so the other day when we went and we picked up the new puppy from a couple hours away, I couldn't even pick up my cell phone in the car to look things up because I'm just that on the edge, and it's a very uncomfortable feeling. And I believe that PTSD can't be treated just on its own. I personally don't know anyone who's successfully treated PTSD without some kind of medication intervention. I'm not saying it doesn't exist, but it certainly hasn't been my reality. And right now I absolutely am in a PTSD flare, and it's horrible. It's absolutely horrible. I was sitting here on the couch yesterday, and Gabriella, my youngest, was on the couch too, as was my husband. And I just got this kind of like blank stare on my face, and then I like closed my eyes and I was just trying to get the vision to go away, and it would not go away. And I said to my husband, like, PTSD, and he's like, what? He's like, are you gonna throw up? Because I started like dry heaving, and I just basically said, just go get my intervention, the PRN intervention that I take for panic attacks and PTSD attacks. So it infiltrates absolutely every part of my life when I am inside of a flare, and that's on top of anxiety, on top of my anxiety disorder. And then when I'm in a flare, my generalized anxiety is also just so much higher, and it reduces my quality of life significantly, outside of the fact that, you know, my heart is going a million miles an hour right now, and that's just from sitting, and you know, like all of these conditions they just play with each other. And you know, if you want me to actually go into detail about the situations that did give me PTSD, or about the types of things that happen in a PTSD flare, I can. I'm trying to keep this as general as possible, because I assume that a lot of my triggers would trigger people who would be watching this video as well. I just want you to know you're not alone. PTSD is really invasive in a person's life. A lot of people self-medicate. They self-medicate with alcohol. They just need that numbing sensation. They need those. It's so difficult to keep your mind focused on a task, say at work, or anything, you know, like keeping your mind focused on a conversation that you might be having with a family member when you're, even if you're not, say, having a flashback to the exact situation at that moment, it increases, at least it increases my generalized anxiety so much that I don't necessarily have to be, you know, imagining or having something go on inside of my brain connected to PTSD to have anxiety so high that I can barely work around it. So, you know, like if that's your case, I really do suggest that you reach out for help wherever you are. I know in Canada, there are hotlines that you can call if you need help. But if you have a spouse, I would suggest not hiding your PTSD from them. And if you can't bring yourself to tell them what your PTSD is related to, which I understand, I oftentimes won't even tell my husband what it's related to. I'll just say PTSD flare. And he knows pretty much instantly that I'm really struggling in that moment. And so, you know, even if it's coming up, like if you don't want your kids to know that it's happening or you're having a flare or whatever it might be, coming up with like a code word between you and your spouse, and them just understanding that you might need to like leave the room, you just might need quiet because extra stimulus coming in, the noise of family, noise can be a huge trigger. I use loop earphone or earplugs oftentimes when I'm struggling with PTSD in general or a higher anxiety, because I will become much more sensitive to sound. I get much more touch sensitive. You can't really touch me. I get jumpy and flinchy, and my dog is trained to do deep pressure therapy and to cuddle. And so he will put his weight across me, and I find that really helps. But just having a moment where maybe the responsibility of life is just reduced a little bit. So if you've got kids running around, like if your spouse can watch the kids, so that you can go to a quiet room even just for a little bit. But talk to your doctor, because it's not worth suffering in silence. And there are a lot of things that we can do nowadays. Like I said, there's ketamine treatment therapy. I mean, that is such an unusual, like, it's just, I don't even know how somebody came up with the idea of let's try this for PTSD. I don't even know. So there's lots and lots of treatment options out there. But I really feel like it's one of those things where once you have it, I don't know that you can kind of ever get away from it. It's just, it might be like in remission, or you might be doing really, really well and it's not bothersome to your life. So unfortunately for me right now, that's not the situation. I'm more than happy to talk more in depth about things. You can reach out. You're not alone. I hope my story helps someone feel less alone. And I really hope that if you do have PTSD, that you're not in a flare right now. But I do think it is normal, that it ebbs and it flows. And yeah, don't suffer in silence. Don't suffer alone. Don't medicate yourself. There's so many other safer alternatives to using alcohol. And if you are using alcohol, I would maybe say confide in somebody and get help with getting off of alcohol. Alcohol is actually more dangerous to wean off of than anything. So if you have been coping with alcohol for a long time, you're going to need professional help with that too. So just keep that in mind. I hope that you guys have a wonderful day. I'm sorry if you've been able to hear all the noise in the background. It just got to the point where I couldn't keep starting the video over again. We're at 50 minutes now. If you stuck through to the end, subscribe. I'm going to be doing generalized anxiety disorder next, because mine is very separate from my PTSD, although my PTSD will also cause my generalized anxiety to be worse. All of these things, they play together, and they're all friends in the sandbox. Oh, and one other thing I wanted to say is, if you can think of, so in the last video, I was talking with my husband, and I was saying how, like, chronic illness, you kind of have to take it outside of yourself, and it's like you and your husband dealing with the situation outside of your relationship, right? Just like if you're going to deal with a problem between you and your spouse, put it, you two stand on one side and the problem is in front of you and you're trying to solve it as a team. And then I was thinking about how we always say, fight, 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 like you're fighting against this, you're a warrior. And while that is true, because you do have to continue, just keep swimming, right? I have started to wonder if perhaps I thought of all of my conditions as friends, I might be nicer to them. They live inside of me, so I don't want to be talking negatively to them. I don't want to be fighting a portion of myself, because then I'm fighting myself and my brain hears what I'm saying and what I'm thinking. And so, with the studies and everything like that, I don't want negative self-talk. I don't want that around me. But, like if I could think of PTSD as my friend is really struggling today, like my PTSD friend is really struggling today, and be gentle and try to help the way that I can, for any of these conditions. Oh, my POTS is, struggling today. What can I do to help them, and then instead of I'm fighting a war against POTS, I'm fighting a war against PTSD or any of those other things, maybe looking at it in a slightly different way will be more beneficial to me than, it doesn't matter to anyone else, but to me, inside of my body, maybe talking a little nicer to these conditions will just make my life a little bit more pleasant. Reach out if you'd like. I do have an Instagram, Chronic Matters, so you can follow me over there as well. But I hope you have a great day. If you stuck around, thank you so, so much. I hope you guys are, in a phase where your PTSD is under control. Bye.